Yeah, I'm Bob Webb, 56 years old. I've had chronic heartburn most of my life. For years, I had ignored it. I dodged the bullet. They found precancerous cells. So I went to my GI. He recommended having an endoscopy. He could not tell if there's any further damage, so he then ordered a biopsy. The results of these all came back negative for precancerous cells in the esophagus. But then he had also ordered a second test in there, the WATS3D brush test. The results of the WATS3D brush test came back positive for high-grade dysplasia. A simple procedure can be done to detect this before it has become cancer.
So Robert's a really nice 56-year-old white male who had heartburn most of his life. He took over-the-counter medications, the classics, Rolaids, Tums, and migrated on to histamine blockers. And then eventually, when he saw a physician, he was placed on proton pump inhibitors. He was on and off these medications for many years, and he told his family physician about his acid reflux, but there was never any referral, despite his complaint, to a gastroenterologist. So Robert took matters into his own hands, and he decided he's going to seek care about this acid reflux problem. So he found a good local gastroenterologist, went to see him, told him his story. The doctor took a history, said, hey, middle-aged, white male, long-standing acid reflux, you need an endoscopy. That's exactly what he needed. So he had an upper endoscopy, and they took 9 forceps biopsies, and they used adjunctive WATS3D technology. The 9 forceps biopsies showed intestinal metaplasia, classic Barrett's, but no dysplasia. But luckily, the WATS3D biopsy showed high-grade dysplasia, which is a huge find for Robert. In Robert's case, with high-grade dysplasia, the rates are variable depending on which study you read, but it's a very high transformation within a 3 to 5 year period, possibly as high as 50% within 3 years, developing a full-blown cancer that may or may not be curable. But because he had high-grade dysplasia picked up on WATS3D, he was immediately referred to a Barrett center like ours for radiofrequency ablation therapy. And typically that takes about 2 to 4 sessions done on a 2 to 3 month cycle. So we instituted that therapy. He had 3 radiofrequency ablation sessions, and his esophagus is back to normal now.